The World Health Organization says Mpox is no longer a global health emergency. WHO announced the change after cases declined in countries like the Democratic Republic of Congo, Uganda, and Burundi, according to their September 2025 briefing. But Africa's Centers for Disease Control and Prevention disagrees. Africa's CDC says Mpox remains a continental emergency. They report rising infections in Ghana, Liberia, Kenya, Zambia, and Tanzania. New cases have also appeared in Malawi, Ethiopia, Senegal, Togo, Gambia, and Mozambique. Africa's CDC notes that deaths continue, especially among children and people living with HIV. More than 1 million vaccine doses have been distributed. Yet most children under 12 in high-burden countries are still not vaccinated. According to Africa's CDC, ending the global emergency now could lead to complacency and reduced international funding. They warn this would harm fragile health systems that are already under pressure. On the other hand, health advocates say this debate raises hard questions. Would WHO have acted the same way if the deaths were in Europe or the United States? The issue is, who gets to define an emergency? Is it WHO in Geneva or Africa's CDC responding directly on the ground? Some experts argue Africa should build its own emergency declaration system, one that does not wait for outside approval. Should Africa create its own health emergency system instead of depending on WHO? Share your thoughts in the comments. According to Africa's CDC, the Mpox fight is not over. When the world says the crisis has ended, Africa is still losing lives. The real question is whether the global health systems take African lives seriously. This is Running Africa News, bringing you the latest stories from Africa to wherever you are in the world.